Hey guys, it's Sarah, and I'm going to talk to you about meningitis in the adult patient. Meningitis is a rare infection that can affect the delicate membranes that cover the brain and the spine. There are several types of this disease, including viral, fungal, parasitic, and bacterial. The first one I'm going to talk about is viral meningitis, and if you're going to get one, this is the one that you want to have. Viral meningitis is usually mild. It often clears on its own. A person might experience flu-like symptoms for 4 to 10 days, but supportive and symptomatic care is really all that you need to do for this. This is the type of meningitis that everybody hopes they get. Now, on the other side of the spectrum, you have bacterial meningitis, and this is the one that has a very high fatality rate. Even when treated, 14% of people will end up succumbing to this. Bacterial meningitis is caused by 4 different types of bacteria, and basically what happens is these bacteria that normally cause just sinus infections or pneumonia get into the bloodstream, migrate to the brain, and set up an infection. So the 4 different types are this: Streptococcus, which is a bacteria that normally causes pneumonia, ear, or sinus infection. Neisseria, which is the most common one to cause respiratory infections, but this is the meningitis that when college dorms explode with meningitis, it's usually the Neisseria that is the cause of that. The Haemophilus was more common before we had vaccinations for that. We don't see it around very much. And then the Listeria comes from unprocessed meats, cheeses, just unpasteurized foods. And the problem with that, you have to be aware in your pregnant patient, is that it can cross the placenta and cause miscarriage or stillborn. Another type of meningitis is fungal meningitis, and you're not going to see this in your patients very often. This is more your immunocompromised patients who have AIDS, chronic immunosuppression. Those are the type of people who get a fungal meningitis. And then the last one is the parasitic, and that's caused by the Naegleria fowleri. This is the one that in the summer times when you hear about water parks getting closed down or being aware of lake water, this parasite lives in stagnant waters. It goes in through the nose when you get water up your nose and tracks to the brain. Unfortunately, even when caught early, this one is almost 100% fatal. Risk factors for these types of things, you want to look for people who have skipped vaccinations. Looking at age, viral is very common in kids under 5. Under 20 is more of your bacterial meningitis, but can also be the older. If they live in a community setting, if your patient is pregnant, or if they have a compromised immune system, those are all risk factors for developing meningitis. So somebody comes into a clinic, what are you looking for? The types of things that you are looking for are a sudden high fever, stiff neck, headaches that are different than normal, headache with nausea and vomiting, confusion, difficulty concentrating, seizures, sleepiness or difficulty waking somebody up, sensitivity to light, no appetite or thirst. These things should immediately start ringing bells and being concerned. But the way that you're actually going to diagnose this are a couple different ways. First of all, the golden standard is a spinal tap, looking at the cerebral spinal fluid. Using that, sometimes the fluid will have a cloudy, hazy appearance. If there is a decreased glucose, it could mean a bacterial infection. It could be that there are elevated protein levels or elevated cerebral spinal pressure. Those are the types of things you're going to be looking for. Blood cultures, obviously we're going to pull those. 80% of the time in bacterial meningitis, the blood cultures will be positive. Doing a CBC may show elevated WBCs. And then there are 2 signs that you're looking for, the Kernig sign and the Brodinski. Those are 2 things that you can do in the office where you actually manipulate the patient, and they're very positive for being able to help diagnose any kind of a bacterial meningitis. Sometimes they do use scan imaging. You can do a CT, which may show swelling on the brain, or an x-ray of the sinuses. Without good prompt treatment, patients can have lots of complications: hearing loss, memory difficulty, learning disabilities, brain damage. So we want to hit this quickly. So what do? You've got a patient who's positive. Immediately you want to go ahead and start heavy-duty antibiotics, ampicillin and cephalosporin, in addition to corticosteroids to help relieve some of the inflammation. Once you find out exactly what bacteria is on board, then obviously you're going to switch your antibiotic to treat that specific bacteria. Again, you want to make sure that you're doing supportive care, fluids, antiemetics. The patient is definitely going to need to rest, and hopefully if you get all these things in a timely manner, your patient will have a great outcome. Thanks for watching.